The Mamelodi Hospital is coming under fire after images circulated of alleged abuse at the hospital. An elderly woman was apparently found tied to a chair. ENCA's Liranzu Temba is at the hospital and joins us now. Good evening, Liranzu. What is the hospital saying?
Evening to you, Vuyo. Well, first of all, this video has really sent shockwaves across the country. Certainly has left the Murray family, demanding answers from this very hospital. We know that this video was taken yesterday at the casualty section of this Mamelodi Hospital. And we also know that 76-year-old Martha Murray was handcuffed to the chairs of the casualty section. Of course, she was here trying to get assistance from her stomach ailment, we understand. She did spend a night on Tuesday night, and we are also trying to get answers as to what exactly led to her being handcuffed to these chairs. But I do have with me the newly sworn in MEC of Health in Gauteng. Thank you so much, Ndate Masuku, for your time this evening. Speaking of hitting the ground running, you were sworn in this morning and you've come here to really see what exactly transpired. You were locked in meetings with the management of hospital. What seems to have happened yesterday here?
Yes, we have received a patient, Martha Marias, in our hospital, and I think one of the things that we have received is the report of what really happened. Some of the things are things that we are going to have to correct, and I think that we are awaiting reports from the people who are involved, and then we're able to deal with the matter as we are going forward. We need to get incident reports from the nursing staff that was there, the doctors that were involved, so that we can be able to do a proper redress with the family and also communicate with our public. But the video itself has shown, as we have said, have sent shockwaves, but we're also very much disturbed about what we've seen in the video.
It's almost 24 hours, MEC, that this incident has taken place. Are you telling me the hospital is not able to give some sort of tangible answers as to who might even have actually done what they did?
Yes, there is tangible answers, but remember that we have to have a comprehensive report. We can't do preliminary reports and preliminary commentary on what we've received. Part of the procedure of grievance and complaint management is that we have to get the proper incident report, also get what the side of the patients from the family itself, and then we're able to do a proper redress with them. And that we are promising that will be done within the next 72 hours, and we're going to close that. We are very hopeful that by Sunday we'll be able to have a formal meeting with the family to deal with the matter and the professionals involved in terms of our ethic code and the professional code that we swear to. They'll have to be actually dealt with properly.
MEC, you did meet up with not only the patient, Mrs. Murray, but also the family members. What did they have to say to you?
No, they did express their disgust on what they've seen, and we did express our apologies to them, and we're saying that we are going to work with them to try and make things work. But in the long term, we need to be able to correct the situation at the hospital. Like we have said off camera, that there have been a persistent number of complaints about the hospital. So the long-term intervention also would have to actually come into place, and we are hopeful that we'll be able to deal with it. The plan was set to be adopted in April, and we need to implement that in full sense and able to decongest the hospital itself, because it is overcrowded, and these are problems that we know that exist in our system, and it's part of the things that we are committing to do and change.
When I spoke to the family earlier on, they said that the hospital had not apologized to them. Has things changed?
I apologize on behalf of the hospital, and I think what I will have to do also is on Sunday, after we've received the report, is to formally apologize on behalf of the department in Gauteng and also on behalf of the people of Gauteng and the Premier.
Right, just lastly, it is your first in office, I understand that, but your predecessor, what are you planning on doing that would be maybe different from what they did, especially to tackle these problematic hospitals? We know that not only this one, but many others across the country have, problems where there's a shortage of beds, shortage of staff, as well as just inhumane treatment of patients.
Yeah, like I've been saying in all the interviews during the day, is that one of the things that we need to do is to improve patient experience. And one thing that has happened in the health department in Gauteng is that we normally, when the new person comes in, we change how we do things. But in this case, because I know Dr. Ramokgopa has been doing quite well in terms of stabilizing the place, so it's just to continue at that bed and make it in a better space and improve the, usually the service. The plan has been adopted in April, the long-term plan, so it's just we have to give it time for it to actually to kick in. So one of the things that we need to do also is the issue of the staff morale that we have to improve in general in our whole system in Gauteng.
Thank you so much for your time.
Thank you so much.
That is, of course, the newly sworn-in MEC of Health in Gauteng, Bandile Masuku, who's just, hit the ground running, coming to Mamelodi Hospital to find out for himself exactly what transpired, obviously telling us that we will know all the answers and exactly what took place only on Sunday. With that, over to you.